We now head west to the state of California, which seems to finally be turning a corner in their battle with COVID. But the sting of the virus and subsequent pain and suffering of the last few months still lingers. Our Zohreen Shah looks at the disproportionate impact this pandemic has had on the Latino community in California.
When the second big COVID wave hit Los Angeles, Ever Linares was one of the helpers it threatened.
He just has a whole heart in helping people.
He grew up tangled with gang members, but turned his life around to give back to his South LA community through his nonprofit, Resilient.
He just decided to transition his life cold turkey.
Transitioned to husband and father of 7. Family is everything to the Linareses. But with so many people under one small roof, the raging virus caught a hold of all of them.
We started to get sick one by one, and as we began to get positive, it was me and my son first. We tried to isolate in a separate room, and then the next day the other results came in for my other 2 daughters, and then Ever was third, and then she and my other daughter were last.
The most recent wave sent cases amongst Latinos soaring 1,000%. Latinos make up 55% of statewide cases and 46% of deaths. Those numbers are not the case in surrounding wealthier, predominantly white areas, and even for much of the drive north, until you get closer to a place called Pacoima, yet another mostly Latino community.
Doctor, what percentage of your patients are from the Latino community?
We serve about an 80% Latino population.
Dr. Allison Campos, a practicing physician in her very own community, says chronic disease has led to many more becoming very sick when they're infected.
One of the big things that I've seen is that we unfortunately have higher rates of chronic diseases, especially diabetes, among other things like high blood pressure and high cholesterol and obesity. And we know that these are some of the main risk factors that increase a person's chances of developing severe COVID, being hospitalized, and also possibly dying.
A community more likely to get the virus, but less likely to get help.
Often our patients are undocumented, and they are often concerned about their legal status when they seek care. Will this be counted as a public charge, for example? And they also don't qualify for some of the benefits that are allowing people to just get by.
And even less likely to reap vaccine benefits.
Also, patients who are afraid and concerned and have hesitation about the vaccine. There are very few in this community currently. Geographically close to where we are, there are only 2 that I know of.
Pacoima is one of the hardest hit neighborhoods in the entire country. Nearly 1 out of every 5 Pacoima residents has fallen ill from COVID, and 1 in about 430 people has died at the hands of the virus.
We've seen about a 400% demand in food. So because of layoffs, lost jobs, lost income, people who never come to a food pantry before are coming to Mend looking for food.
Janet Marinaccio, Men's Organization CEO, says there never used to be a line for food, but in recent months, it crawls around the block. It stays that way for hours.
Typically, we might spend about $25,000 or $30,000 a year on food, supplemental food. This year, so far, it's easily over $100,000. They can't afford not to work. They can barely afford life when they are working. So to lose income places their family at risk.
Lara Hidalgo, another Mend employee who also grew up nearby, says it's been a struggle seeing her community pummeled by the pandemic.
We get updated COVID case numbers, and our communities are always the highest. It is gut-wrenching because here we are on the front lines trying to prevent a lot of this from happening, and unfortunately it's gotten out of control.
She fears losing pieces from an entire generation.
I do sense the fear, and I think touching on culture, it's just important for us to continue to uphold a lot of that culture and a lot of those traditions, because we are seeing the loss of our seniors.
Back in South LA, the fear of losing elders eventually hit the Linares family. Ever got so sick, his wife Andrea had to take him to the hospital in November.
I remember giving him a hug and a kiss and telling him it's going to be okay.
That was the last time she held the love of her life. She watched him walk into the hospital he had stepped into so many times before for other chronic care. Weeks later, a seemingly routine hospital call.
When they called me that evening, I thought it was the nurse to FaceTime for that evening, and they called me to let me know that my husband's heart rate is dropping.
The family rushed to say goodbye, but they missed him.
We got there like literally 3 to 5 minutes late. He had passed away already.
Passed away at a time his community was desperately in need of him the most for his food and PPE giveaways, his encouragement with gang members to turn their lives around. All of that suddenly gone.
I have a lot of people, when he passed away, come and tell me all the good he did to their life. It was always him last. He always put people before himself. He made sure we were good. Even if we didn't have anything, he'll make sure we were fine.
Zohreen Shah, ABC News Live, Los Angeles.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.